Hit hard with a major staffing shortage. Tonight we are zeroing in on Oregon's dental industry. Now clinics say it's getting so difficult to hire dental assistants. They're now asking for millions in state funding to train a new generation. Our Catherine Cook looks into what it all means for patients.
Truly, this is a problem for the entire state.
In her 14 years as a dentist, Dr. Caroline Zeller has never been more concerned about staffing, specifically among dental hygienists and assistants. The Oregon Health Authority reports dental offices lost 56% of their staff during the first year of the pandemic. For perspective, physicians' offices lost 11%.
We see the effects of it already, and it's putting us back. Patients are having to wait a lot longer, patients that have infected teeth, patients that are in pain.
The problem, according to many in the industry, is not enough aspiring dental care professionals in the pipeline. That's where House Bill 2979 comes in. It would put $20 million toward addressing the dental workforce crisis. The money would fund various training and education programs for college and high school students, as well as on-the-job training. It would also expand existing incentives for dental professionals serving in high-need areas.
I can speak to how difficult it is to hire a dental assistant because I've had ads out for the last 3 years without much success. Creating a publicly accessible training module for dental assistants will help create more opportunities for individuals that want to enter the dental profession, particularly those in rural areas.
Representative Hai Pham from Washington County is the bill's chief sponsor, as well as a pediatric dentist. Dr. Cyrus Javadi also offered support. He practices on the North Coast and stressed how much more difficult this crisis is in rural areas without access to training programs in their communities.
The closest training program is 2 hours away. It's just not feasible and that's for Tillamook, Astoria, it's even further. It's too much of an ask for people who are interested in the dental profession to change their entire lives to move closer to these training programs.
For providers like Dr. Zeller, their thoughts always go back to what it all means for their patients.
Having to cancel or schedule them months later has massive effects, not just on how they're feeling today, but what their oral health is in the future.
Some dental professionals are concerned this bill doesn't do enough to address dissatisfaction over pay, especially among dental assistants. They believe that's one of the main reasons people aren't filling those positions. They don't think improving access to training is enough to address that frustration. David.
Catherine.